Primary adrenal insufficiency. So looking at etiology, it can be the autoimmune as well as infections. Infections, you can tell it can be TB, it can be HIV, it can be fungal as well. Next, it also includes the hemorrhagic infarction. This can include the meningococcemia as well as the anticoagulants. Next, there is the metastatic cancer, which can include the lung. Now, moving ahead, looking at the CP, there is a clinical presentation. It can include acute. Acute, it mainly includes the shock, can include abdominal tenderness. This is with the deep palpation. Next, there is also the unexplained fever. There is nausea, vomiting, weight loss, as well as anorexia. There can also be electrolyte disturbances such as the hyponatremia, the hyperkalemia, the hypercalcemia, as well as the eosinophilia. Now, the same thing looking at the chronic. There is weakness, fatigue, gastrointestinal, such as same thing, the nausea, vomiting, headache, abdominal pain. There is weight loss, hyperpigmentation or the vitiligo. Here there is the hypotension, hyponatremia, hyperkalemia, as well as the hypercalcemia. There is also presence of the anemia and the eosinophilia. Now, looking at the diagnosis of the primary adrenal insufficiency. Diagnosis includes the, firstly we measure the ACTH and the serum cortisol. This is with the high dose of up to 25 microgram, and the ACTH stimulation test is performed. Next, there is the primary adrenal insufficiency. It includes the low cortisol and the high ACTH. Next, there is the secondary or the tertiary adrenal insufficiency. It includes the low cortisol and the low